Well, hello again today. Merry Christmas, Happy Hanukkah, Happy New Year's. Um, we are going to be talking about bird flu today. You're starting to see bird flu hit H5N1 for the technical geeks, and we'll talk about what H5N1 actually means. In fact, well, before we show that, I'll tell a personal story. So there are three families in the Brewers and a couple of relatives. My sister and her daughter's family all live in the same area. Uh, One of the group was going to get some eggs because that person, and you have seen her on the show. It's Heather, my niece. If you've seen our egg show, Heather appeared on that. She has a backyard flock. She has about a dozen chickens, and occasionally the chickens will get eaten by a possum or a raccoon or a hawk. Now, the reason I'm talking about all of that is we wonder how these bird flus spread. Well, a hawk is very good at spreading bird flu. So are geese, and they fly from one lake or pond to another. So, yes, there's some stories here, but the stories do have some little Easter eggs in them about what we're talking about today, the bird flu. Anyhow, Heather went to get eggs for a couple of families because too many of her backyard chickens have been eaten by predators like hawks. She went to the grocery store and they didn't have eggs. And she asked the grocer, and he said, "Well, here's the problem." He said, "Our suppliers are not able to send us eggs right now." This was in Ingles, I think. Um, and she said, "Why?" And she said, and he told her, he said, "Well, the suppliers have had to kill too many chickens, too many of their chickens because they had bird flu." So, you may have heard about this being transmitted to humans. There have been a few human cases so far. And again, the last few times we heard about bird flu, there was major fear of a pandemic. We'll talk about that a little bit later. Hey, Susan or Gilbert, if you'll show the H5N1, I'll just go into some geeky science for a few minutes. You okay with me doing that, Jesus?
You have my permission.
Oh, that's very nice. So go ahead and show the H5N1. So this is a schematic or a diagram of a virus. And you see these two things here. The red ones, I believe the red ones are the red ones are, this is the way that the flu virus has evolved. It's evolved with these two types of what we call antigens or markers on the outside. The reason that that flu is so effective at avoiding, you may ask the question, for those of you who get vaccines, you may have said, "Well, I got flu vaccine last year and the year before and the year before. Why can't they just give me one vaccine just like the other bugs, measles, mumps, rubella, the other vaccines? Why can't they just vaccinate once for this instead of having to vaccinate every year?" This is why. It's that those antigens on the outer core. The H is called hemagglutinin, as you can see on the left, and the N is neuraminidase. And each of these has, I don't know if you know the number, Jesus, but it's 5 or 10 different versions. So you could get H1N1, H2N2, H1N3, H5N1. And H5N1 this year is associated with birds, which brings up another point that I brought up about birds a few minutes ago. And that is how birds transmit this and how this gets transmitted from farm to farm. there is a global sentinel system for watching this. The CDC is obviously involved, WHO is involved, and I know there are plenty of CDC and WHO critics out there. That's neither here nor there, how well they do their job. This is a different issue. What they do with these Sentinel programs is that a lot of them focus on the Eastern, what we call the East, China. And in China, at least in the past, you've had a whole lot of mixing. So you'd have rice paddies. You'd have a lot of geese that flew from one rice paddy to the next, to the next, to the next. You would have other animals in there like swine, pigs. So for example, a goose infected with one of the flu viruses flew over a rice paddy, would poop in the rice paddy and maybe poop in the goose's, in the pig sty, and then infect the pigs. So you begin to get an idea of how this is a challenging thing to control on a year-by-year basis, and a little bit more of an idea about how the Sentinel processes work. Now, one of the questions that's going to come up for the vaxxers out there is, okay, well, do we have enough of that, or do we have any of that vaccine? Do we have it specifically? Because in the past, I believe it was the swine flu debacle back in the Nixon era. The CDC set up flu vaccination during that time period, and it turned out to be the wrong one. And how would that happen? So the way that happens is, as you might guess, the WHO and the CDC and the other national health groups that are responsible for this are always each year in a mode of trying to figure out which virus, which combination. Is it going to be H1N1 or is it going to be H5N1? What's it going to be? And at the time that they have to make the vaccines, they have to do their best guess. Sometimes their best guess is wrong, because it's like predicting the weather. This is a moving, changing process as these viruses go through different populations. A pork population in 3 or 4 farms in China versus getting carried to other groups. So again, this is not a simple, easy process. It's about as good as predicting the weather. Now, actually, in terms of results, usually they get a little bit better shot than that, and you can tell that from the batting average for the flu vaccines. So another question that's going to come up on this year, and Jesus will be ready to answer that because he's our expert today, is those of you who are planning to take vaccine or already took it, did it have H5N1? So Jesus, are you ready to come in and be the expert?
When you call me expert, that's really a stretch. So
it is.
Let me tell the audience what we plan on doing on Mondays. Hi, everyone. The idea is we're looking for news and give Dr. Brewer's thoughts on them, or at least stories from many years ago. So that's the thing. But we're also trying to give you some useful things that you can use. So let me share real quick a couple of tips that we have. And yeah, just to answer your question, there's no bird flu vaccine that has been approved or studied by the government right now. I know if you don't trust the government, that's as far as we know so far. There might be, but there isn't right now. Things that you can do, because there is a potential for this to become a pandemic. A couple of experts like Dean Blumberg from infectious diseases at UC Children's Hospital, and Deborah Birx, which was the previous speaker from the COVID task force a few years ago when COVID started. They were saying that the main problem right now is mutations. Somebody who has another type of influenza virus going on, a human type of influenza virus, then gets bird flu. Those two viruses can combine within that person, and the virus might be able to mutate. So the H5N1 virus The thing of with that bird flu virus is that it's usually a thing that affects birds, and since it only affects birds on humans, this thing wasn't able to survive that much. It doesn't adapt to the respiratory system of humans. But on this mutation they found 2 days ago in Louisiana, this patient, it seems that that mutation actually helps that bird flu virus to adapt to the respiratory tract of humans. So that's a problem. Anyhow, things that you could do to avoid problems or avoid the spread of this disease: minimize exposure. And the slide got cut off, but remember pets. Sometimes pets will go along and play with dead birds or sick birds, so you have to be careful about that. Beware of raw milk. I know there's a lot of hype about benefits of raw milk, but the problem is you can get bird flu from cattle, because the bird flu has been able to survive within cattle. And if you drink the raw milk, there has been studies showing that there are viruses within that raw milk as well. So there's potential of harm. Do not cook if you're sick. You might not have the bird flu, but if you're cooking while sick, you can also spread all those small droplets of any virus that you might have. So that's the problem. I know this is going to get a lot of backlash. Consider the flu shot. I think Dr. Brewer and I do get the flu shot every year. Has that damaged your brain so far, Dr. Brewer? Are you gonna blame it on the vaccine?
As
Are
you've
you?
noticed, I have word finding problems. My perspective is, and that's one of the first things that happens with senility. But as I've pointed out many times, I had word finding problems when I was in the 4th grade. And that was, what was that? 57 years ago. So if this is a first sign of senility, or maybe the statins, or maybe the flu vaccine, then so what? Or I don't.
Well,
Obviously, I'm being facetious.
that's the thing. Like I can give you my experience with the H1N1 epidemic, the swine flu. It got me when I was in first year of med school back in the day. I believe it was 2009, 2010. I got knocked out by the infection. I thought it was just some other type of influenza. It ended up being the H1N1. I used to live in a house with other med school students. They went to check on me on my room. I was feverish. They rushed me to the hospital. I spent 1 day on the hospital. I was discharged. Go back to the house. It was better. But the thing is, I don't remember anything from that day, like anything. I don't remember leaving the room. So I was lucky enough not to develop pneumonia. But I know there's a lot of conspiracy and stuff behind that. I cannot say it's right or wrong. I just can say, if there's a new virus and people are expecting for that to happen, even the CDC has said that there's a big potential of another pandemic. They just don't know when or which virus is going to be. This could be. We're not saying this is it. We're saying this could be. He says, Mark, and he's right. CDC says person-to-person bird flu spread risk is very low. Right now it is, and actually they're saying that the risk is still low. But that's the same thing they said about COVID back in December and January of 2019 and 2020. The problem is the mutations.
There's a science issue on that, and I'd like to share that. So,
Sure.
Any of the pandemics that we've seen, the last was the last bird flu back in the late 90s? May have been. Anyhow, I was at Toyota at the time, and everybody was scared to death whenever these new flu versions or strains are seen. And they come in, and at first, they're always very low human-to-human transmission. They also usually come in, and they're very lethal. And everybody gets scared, but then they're saying, well, maybe it's not going to transmit. Here's what happens. These things mutate very quickly. And what are they going to mutate towards? Well, if the mutation that allows it to transmit from human to human is going to be the mutation that survives. So it's going to mutate towards easier transmission. But the other thing that it's going to do is if it kills the person quickly, that's not a good a good a good thing for the virus either. It can't transmit further. So it's going to both increase its ability to spread, but decrease its virulence or its mortality
Well,
rate.
any virus, what the virus wants is to replicate, and they
Right,
cannot replicate on a dead host
right,
unless that dead host is an animal, which is makes it easier because of the animals will eat. Well, there's still a cadaver over there, but once it reaches humans, that's what happened with COVID. The new COVID strains are more transmissible, but not as lethal. The
right.
problem is the world basically shut down during COVID, and you can argue behind why that happened. If somebody created the virus, if this is a plan from the government to make money to kill people, you can argue against about all of that. The problem is the virus is there, and it's killing animals right now. We don't want it to reach humans and start mutating as it happened with this person of Louisiana 2 days ago. So this is one of the other things to consider. If you're a dairy cattle worker, protect yourself while you're exposed to these animals, and consider testing. There are tests for this, specific testing. It doesn't have to be for everybody, but the people who are managing cattle and are managing chickens, it should be at least on the discussion, because it's the same thing as it happened with COVID. There are no symptoms. A lot of people, there are no symptoms. You can have it, but even if you don't have any runny nose or headache or whatever, it can just be there. And the other part is, it is safe to eat the chicken, and it is safe to eat the eggs that are on the store, but you need to cook them. Heat is gonna kill any virus anyway. So those
So
are kind of the remarks we wanted to bring out. Yeah.
another story about my family. my the mother's side of my family has a bunch of farmers in North Carolina. A lot of them were chicken farmers in the past. Some of them are still turkey farmers. And way back in the day when I remember as a 8 to 10-year-old, we used to feed some of the dead chickens to the hogs, and they would eat them raw. And I would just say, if you live on a farm, especially in Louisiana, and don't let your dogs or hogs eat any raw dead birds.
Yep. And of course, if you don't want to get a flu shot, that's absolutely fair. I mean, I think, and I can understand, if there's one thing we learn about vaccines is that they're not innocuous. Some people developing cardiomyopathy with the flu shot. I can tell you, my wife, she only started getting the flu shot after she realized that every time she got influenza in December, it was knocked out. She could be on bed for 7 days. It hasn't happened since she started getting the flu shots, but not everybody's experience is the same. I can understand some people having side effects and saying no more for me. But what happens there is that then you have to be extra careful of not getting the disease. And the worst thing is, if you're near somebody who is immunocompromised, who doesn't have a really good immune system, we can be spreading it without knowing it. So those are kind of things that you need to consider.
Yep. Francis Nance asked the question, can't we just vaccinate all those birds, the pigs, the ducks? No. I mean, you can't, like I said before, wild geese and hawks may be a couple of the major transmission items, and you can't reach those. You can't feed them. And even if you could feed them, this is not an oral vaccine. Some vaccines are oral, but that one's not.
Yeah.
You got to inject them.
Yeah. And we're just trying to give you kind of the information that it's there, because on the sea of things that you see online, it's really easy to get wrapped up on what's wrong and what's right, what's true and what's not. And I understand the distrust in government. I think there's a lot of stuff back there. I'm not saying there's not. There aren't things happening, but as somebody who was involved during the COVID pandemic, I was able to go within the places where you got the sick people. It's awful. Like I saw it myself. Nobody told me that. I saw people testing positive to COVID. I got tested myself. I got some COVID shots. Uh, I hopefully was fortunate enough for being young enough not to die from that. But a lot of people died, and this thing could be something similar. And this is just a starting. And I don't think this outbreak is going to be the last one. Like even if we manage the bird flu right now, there's going to be more outbreaks here and there. It's just the nature of things. Uh, so we only can do what we can do to protect ourselves, improve our immune system, improve our diet, and try to help people understand that science is not black and white. Medications, anything that we develop for helping us is going to have side effects, and it's up to us to decide if we want to risk it or not. But consider that I'm not saying you to get a bird flu shot right now, but clearly an influenza shot, especially if you're older, something you should consider. If you're concerned about side effects, well, you can just not do it. But you need to know that you will have to be extra careful not to get sick.
We've got Ritter a lot saying this is fear porn, and Jennifer H saying, are we really going to fall for this again? I agree. There's a lot of folks that will be careful what you read. There's a lot of fear porn out there about any of this. And the reality is, as Jesus said a minute ago, these diseases are real, but they're diseases. I mean, and so therefore you can learn the science behind them and make your own choices about how you're going to react. And that's what this whole channel is all about, helping folks understand the science behind diseases so we can decide, so they can decide on their own how they're going to react. Yep. And quite often, for most diseases, there's a major opportunity in terms of prevention.
I'm going to give you one more example, just so people can understand how nuanced we are. While during the pandemic, I was working on the hospital. I was doing my residency program. So my task was to take care of the healthcare providers. I was in preventive and occupational medicine. So my role was to make sure everybody had their safety equipment and they were vaccinated and testing and all that stuff. I got 4 COVID shots on the lapse of 2-3 years. Lately, here in Mexico, they're saying, here, this is the COVID vaccine if you want to take it because of the new virus. Right now, I don't think the cost benefit is good. Like, I won't take another COVID vaccine right now just because of what we discussed. There might be more transmission, but it's not as lethal. And the COVID vaccine has a lot of side effects that have been proven. So I'm sorry, I lost video, but the whole point is you can be nuanced and say, hey, you can make your own choices. And right now, I think there is more benefit from the year influenza shot than there are risks. Maybe for older people can be different, so I understand if you're concerned about it.
As with both of them, and you've already mentioned this, it's a very different risk-benefit equation for a 70 or 90-year-old than it is for a 30-year-old. Why not use better integrity means all? Why not use better protection instead of moving so recklessly? Same as with other diseases. Try to remain distant and stop going to public places and stop being hedonistic. There's a whole lot to be said for, you're just basically talking about hygiene, infectious disease hygiene.
Yeah, right now, the ones who are on the front line are, as we mentioned, dairy, cattle workers, and people who work with chickens on farms. They are on the front line because if this thing can spread into humans, it's going to be with them first. Yeah. So that's the thing we need to be careful of. And if you're working on a farm, just be aware of that. Like, it's unfortunately diseases like that. You know about occupational medicine, Dr. Brewer. Like, every job has its own risks, and for people working on farms, infectious diseases coming from animals is one that is there every day. And now with outbreaks, we just want to make sure not to panic, but understand that we need to be mindful about the risk.
Well, that's exactly why Jesus came to work for me. It was sort of an occupational medicine issue. Your commute was very dangerous.
Oh yeah, I always died. I always died on a crash. Semi cut me off, and I'm almost crashed. That's when I decided I'm not gonna be working on this place, commuting 45 minutes every day.
On one of the worst highways in Mexico. So,
Oh yeah,
so now your commute is from your bedroom into your living room.
and then to exercise a little bit. Anyhow, the whole point was to make this brief, just to give you an update on the news. Next Monday, we're gonna try to next month, probably next Monday, no, because we're gonna be, well, maybe yes. Well, I'll see what we can do. We'll decide. We're gonna have a special event next week. But
Hey,
anyhow,
before we go,
oh yeah,
do you
go ahead.
know the answer to this one? If you got the flu shot a few months ago, what strains were in it?
That's a really good question. Let me see. Let me see if I can find it real quick.
And thank you, Nancy Haynes. She's saying, look, yours is the best explanation. The science, the possibilities. Thank you. Risk benefit analysis. Thank you both. You're very, very welcome. It's nice to hear that, because we could both be doing something else, but
yeah,
we've got a little bit of background.
So this is it. For the 24-25 season, this is a trivalent, which means it protects from 3 flu strains: H1N1, H3N2, and B-Victoria virus. Remember, there's type I, B, and C on flu viruses, and I got it right here because I don't have the best memory. 18 different hemagglutinin subtypes and 11 different neuraminidase subtypes.
So what you do there is, what is it? 18 factorial times 11 factorial times what? 3 different flus. No wonder it's what? That's hundreds and hundreds of different options available to the flu.
Yeah, exactly. So and again, we understand, like, if there are hundreds of possibilities and you're just getting a flu shot for 3 of them, is that worth it? Well, these are the ones that are usually going up on cases on during winter. So that's the thing.
Very good. Anything else?
Nope. Thank you so much for joining us, guys. We know we didn't post it on Saturday. We're trying to post this upcoming Saturday a really good show. And just remember, we're gonna be trying to give you more a balanced view on all this stuff. And at the end, it's up to you to make your own choices. So whenever you say, I do my research, make sure to verify that it's some good sources. We try to be one of the best sources out there for you guys.
Thank you much.